Hello, my name is Myla Lopez, and I will be doing my video presentation, my media showcase on diabetes mellitus type 2. First of all, I would like to discuss the anatomy and physiology of the pancreas. The pancreas is located behind the stomach and between the duodenum and spleen. The reason why I would like to discuss the pancreas is because the pancreas is an organ essential to function of both digestive and endocrine systems, which is responsible for the secretion of insulin and glucagon. Insulin is secreted to lower blood glucose levels, and glucagon is secreted to increase blood glucose levels.
Okay.
I know my topic is on type 2 diabetes mellitus, but I would like to discuss the five types of diabetes. Number one type of diabetes is pre-diabetes. I know many people probably don't think that being pre-diabetic is a big deal, but it really is a big deal because it gives you the opportunity to prevent your diabetes to further progressing to diabetes type 2. Well, prediabetes is a condition in which blood sugar is higher than normal, but not high enough to be classified as type 2 diabetes. Type 1, the second type of diabetes is type 1 diabetes, which is autoimmune insulin deficiency disorder caused by the destruction of pancreatic islet beta cells. Insulin deficiency means that the pancreatic beta cells do not secrete enough insulin. The third type of diabetes is type 2 diabetes, my topic. Type 2 diabetes is an insulin-resistant disorder. Insulin-resistant means that insulin is being produced, but the body does not use it effectively. In an attempt to compensate for this lack of response, the body secretes more insulin. This type of diabetes is more common among children and young adults. The fourth type of diabetes is latent autoimmune diabetes, which most commonly occurs in adults, and it is also known as 1.5 diabetes. It is a condition in which type 1 diabetes develops in adults. It has the same characteristics of type 2 diabetes. The only difference is that antibodies are present. Latent means present but not visible. The fifth and last type of diabetes that I would like to discuss is the gestational diabetes. This type of diabetes occurs during pregnancies. It usually disappears after delivery. However, most of these women have an increased risk to develop type 2 diabetes later in life. Hello, Arthur.
Hi, my name is Arthur Augustine Jr.
What kind of diabetes do you have?
Type 2.
What's your regimen?
What do you mean by that?
Do you exercise? Are you on a diet?
No, I just like to take long walks, and try to ease the friction, that I have,
Well, thanks for the introduction, Arthur. Is it okay if I interview you tomorrow with some more questions about diabetes?
I think that would be a great thing to do, and because I want everybody to know that diabetes is no joke, and people think that you can't have it or you can't take it away. You can't take it away. You just gotta try to live with it,
Okay, thank you, Art.
And I'll see you tomorrow.
Hello, Arthur.
Hi.
I have some more questions about your diabetes.
Okay.
What kind of diabetes do you have?
Type 2.
How long have you had diabetes?
Probably for like 10 years now.
How often do you check your sugar?
Not regularly like I should, but I do check it.
What medications are you taking for diabetes?
Metformin.
Are you able to recognize the symptoms of a high blood glucose level?
Not really. Unless I go to my primary doctor, yeah.
Have you changed your diet since you've been diagnosed with diabetes?
Not really. I mean, I still eat the foods you know, that are bad for me, but I try to eat more vegetables and fruit and stuff like that, but
What is the hardest part of being diabetic?
well, staying away from the foods that I like. I mean. So that's probably the biggest challenge, I guess.
Has your social... Okay. The signs and symptoms of hyperglycemia, which is high blood glucose level, are increased thirst, headaches, trouble concentrating, blurred vision, frequent pain, fatigue. The signs and symptoms for hypoglycemia, which is low blood glucose level, are shakiness, nervousness or anxiety, sweating, chills, and clamminess, irritability, confusion, rapid heartbeat, hunger, and nausea, sleeplessness. Um, the big question is, what is diabetes? No, the big question is, what is the cause of diabetes? Type 2 diabetes has several causes, but the most important causes are genetics and lifestyle. A combination of these factors can cause insulin resistance. Insulin resistance is when your body doesn't use insulin as well as it should. Insulin resistance is the most common cause of type 2 diabetes. If diabetes runs in your family, there is a big chance that you will develop the disease. Examples of poor lifestyles are lack of exercise, unhealthy diets such as high fat, high sugar diets, and being overweight or being obese.
Did you get it?
The treatment for hyperglycemia and hypoglycemia are for both symptoms, for both high blood glucose levels and low blood glucose levels, are to check blood glucose levels 3 times a day before meals. Change diet to a low-fat, no-sugar diet, and exercise and stay active. Medications for hyperglycemia include insulin therapy, acarbose or Precose, and Mellitus or glycet, and metformin. The medications for hypoglycemia are Ernade and Byetta, Sax-L-Liptink, and Victoza. The goal of treatment at first is to lower your high blood glucose level. Long-term goals are to prevent complication. Some people with type 2 diabetes no longer need medicine if they lose weight, but become more active. When they reach their ideal weight, their body's own insulin and a healthy diet can control their blood glucose level. The prognosis of type 2 diabetes is that diabetes is a lifelong disease and there's no cure. So if you're pre-diabetic, it is strongly suggested that you change your diet and exercise to prevent the diagnosis of being type 2 diabetes. type 2 diabetic and having to poke your finger 3 times a day before meals. Diabetes leads to diabetic retinopathy, which is when diabetes damages the blood vessels in the retina and causes loss of vision. Diabetes also leads to heart disease, kidney disease, and peripheral neuropathy, which is damage of the nerves affecting hands and feet.
Did we get it?
So this is the end of my presentation, and I hope you all have learned a little bit more than what you have already known about diabetes and how dangerous this disease is. It might be not taken lightly because it's so common, but it's a serious disease that people have, and it affects all organ systems and leads to blindness also. Well, thanks for watching my video.
Okay.